Gentlemen, thank you for your leadership. Greatly appreciate it. So this hearing is Shark Tank, reality TV show. Alaska knows a little bit about reality TV shows. And I've got a stress test for you today. And that stress test is Cordova, Alaska. It's a small fishing community, population about 2,000 in the winter. It doubles during the summer when the fisheries come on. It's a strong fishing community, 7th in volume of landings in Alaska, 16th nationwide overall, about $50 million in revenue plus. So it's significant for us. I mentioned that it's a small community, so that means it has small hospital facility. It's licensed for 23 beds. 12 of those are long-term and are occupied, so we basically have 6 available beds for the community there. The fisheries begins, the big salmon season, the Copper Rivers are coming on, and that season begins May 14th. So we are moving on to it very, very quickly. We've got 5 processors that work in town. They bring in, on average, about 450 seasonal workers. Total workforce there is about 550. Yesterday, we had the first positive COVID test that we have seen in Cordova, and it was a worker who had flown in to begin the fisheries season. And I want to share with you what the community of Cordova, in collaboration with the processors, has done to make sure that we keep this virus out. All out-of-state workers are gathered in Seattle. They're put up in a hotel room. There are security guards at the doors. They're tested, and then they wait until the tests come back. If they are cleared, then they are put on an airplane, either a charter or Alaska Airlines, flown direct into Cordova. They're met at the airport. They're put in a special bus. They go directly to the processing facility where they are again administered a second test. It was on that second test that this individual tested positive, and they got the results just yesterday. The individual was asymptomatic. So we've got a situation here where you've got a community that is completely cut off from the rest of the world. You only get in by airplane. There's been no ferry for the entire winter. You've got a situation where we now have 3 Abbott ID analyzers. We're waiting on a Cepheid test. All the other tests are completed by swab, and those swabs are then flown to Anchorage, an hour's flight away. We have about 1,300 tests that are available in the community now. So I talked to the mayor. I'm texting back and forth with the mayor last night, speaking with our chief medical officer, Dr. Zink, last evening. What do you need? We've got the Shark Tank going on. What does Alaska need? We need to have at-point testing. We have to recognize that when you have these rural distances, it just doesn't work otherwise. It has to be easy to run. So, Dr. Collins, you've mentioned the RADx up demonstration, and that sounds very intriguing, and I'll probably be calling you along with Senator Cassidy here. But you've indicated that it is intended for those areas that are hard hit. We don't want Cordova to be hard hit, because if Cordova is hard hit, that fishery doesn't move forward, and it's not just Cordova's fishery that doesn't move forward. It is the Bristol Bay fishery that will be coming up in another month that is going through these same protocols here to try to determine if it's even possible to open up a fisheries. This is our economy. So I appreciate what you're saying about testing for those that are hard hit. This is your stress test in the Shark Tank. What are you going to give me?
That's a great story and a wonderful way to point out just
It's
how
for
critical
real,
this
though,
is.
and it's in real time.
So Shark Tank aims to give you, by the end of the summer, it's not going to help you this month, a kind of point of care testing that you really would love to have, where you have an immediate answer within an hour. And you can actually not just test people when they come in, but maybe test everybody every week to be sure that there's not something brewing there. Because you always worry about a negative test from somebody who actually has the virus, but not enough of it yet to pop up on the test. Maybe that's what happened with the individual you talked about who had a negative test and then it went positive. So you'd want to be able to do this continually. And of course, as you say, you want to be able to do this in a way that doesn't require shipping the sample off to a central laboratory and waiting for the result to come back if it does. You want something that's going to work right there, that's affordable, that's highly accurate. Then there's a little bit of a knock on the Abbott test. Have false negatives where you have somebody who probably is already infected, but the test doesn't quite pick it up yet. We want to drive that number up to 100%. So that's what Shark Tank aims to do for you. Meantime, this whole business of RADx Up, the idea of providing a special attention to places where testing has not been available, I think you make a very good point. It doesn't mean they have to already be hard hit. It means they're vulnerable to becoming hard hit if the testing isn't accessible to them in a very special circumstance, and you've just taught me about one of them. Thank you.
I'll look forward to speaking with you more about it. Thank you.